I want to talk a little bit about AI and machine learning. We see it more and more in cell and gene therapy. We certainly cover it more on cell and gene. And I wanted to know from your perspectives, how will AI and machine learning impact us in 2024? Uh, and what level of FDA regulation, are we looking at? Um, I'd love to get your input on that.
I think that, yeah.
Yeah, go ahead. Go
Yeah,
ahead,
go ahead,
Nicole,
Peter.
please.
No,
No,
you
go ahead,
go.
please. Okay, so I mean, for us in AI, so I think we are among those who realize that either you'll have an AI strategy or you'll be left in the dust. So our AI strategy right now, I think AI for us will be very helpful in some of the analytic tools that we're using. I suspect that we'll see sponsors using this, particularly as we're thinking about analysis of genomic sequences, which come in certain submissions. There probably are additional areas that you'll see us use AI in, helping us with some of our safety surveillance work. In terms of applications of generative AI, probably not going to see that in 2024 as we feel our way around this, because we will be somewhat cautious. And I think we do believe that sponsors deserve human review of their applications. But we will use the tools of AI. And I think during 2024, we'll be spending time, not just at our center, but it's going to happen across FDA, trying to further refine our strategy for dealing with AI because it's moving so rapidly.
Mm-hmm.
Yeah, and I mean, to the question of what level of FDA regulation are we looking at here, I really think that the same principles apply, that we really are looking to make sure that what we're giving to patients is both safe and effective. And that doesn't change in terms of if sponsors are leaning into using AI learning or machine learning as well. I mean, it's essentially the same review process is needed on our end to ensure that what we're putting out there is both safe and effective. So that's without having a bit of the detail of where we're talking about using this specifically, I would say that in terms of our regulatory process, that will continue.
Sure.
We do have pieces in place and teams in place, as Dr. Marks alluded to specifically look at AI and machine learning in more detail, and where can we even leverage some of that in the pharmacovigilance space as well.